欢迎收看《家国纵横》，我是康凯。南半球，特别是非洲国家，在新冠疫情下容易出现一种资讯流行病，也就是假消息比病毒更为流行。利用人工智能以及大数据的科技，如何识别到疫情的爆发热点，以帮助政府制定有效的应对措施呢？新冠疫情在全球爆发至今2年，变种病毒 Omicron 继 Delta 之后更具传播感染力，让很多国家与地区的政府措手不及，医疗系统应接不暇。这一情况在南半球尤为严重。世界卫生组织今年2月初表示，对非洲的新冠疫苗供应量虽然已大幅增加，不过目前非洲总人口只有11%完全接种了疫苗。如果要今年年中非洲大陆实现设定的70%目标，那么疫苗的接种率便需要提高6倍。
We have developed a COVID-19 monitoring dashboard that visualizes locally relevant information to the public and policymakers in the 9 African countries where we are currently working. The dashboards that we have in these countries are the official dashboards used by policymakers in Botswana, Eswatini, Cameroon, Mozambique, Namibia, Nigeria, Rwanda, South Africa, and Zimbabwe in order to monitor the spread and the growth of COVID-19 in their countries.
Dr. Kong 本身是非洲加拿大人工智能及数据创新联盟的总监。
During the COVID-19, the ACADIC, which is the Africa-Canada Artificial Intelligence and Data Innovation Consortium, has been able to predict all waves in each community in these countries in Africa.
他们团队的研究收集了本国数据以及非洲9个国家的数据，因为很多非洲国家在获取新冠疫苗方面都遇上不少阻挠。人工智能就可以分析人造卫星的数据，追踪到贫困地区，预测旱灾、水灾，以建造更好的基础设施来防止灾害，并在自然灾害之后强化资源的分配。
A disease outbreak response requires timely exchange of information between policymakers and the public. People are usually keen to see how the dynamics is evolving in their communities where their family lives or places they plan to travel. This dictates the need for an urgent dashboard during an outbreak. To this end, we integrated the power of artificial intelligence, predictive modeling, and simulations to develop COVID-19 monitoring dashboard that visualize information and that is locally relevant to the public and policymakers.
他的研究团队指出，世界上有大量人口在社会上处于弱势，包括残障人士，或因为族裔、性别或性倾向而属于少数人口，还有儿童、老年人、容易受伤害的社群等。这些群体或个人由于社会结构性的不平等，日常生活都要忍受超乎常人的成见与障碍，影响他们循公平途径获得应有的教育、医保以及其他的资源及服务。
Obtaining locally relevant data in Africa to train artificial intelligence-based algorithms is essential to inform public health policies in an evidence and data-driven fashion. However, in Africa, this is rather challenging. During an outbreak, community leaders are usually aware of what is happening in the local community, and modelers have the tools to solve the problem, but most often, these people do not talk to each other. So in ACADIC, the Africa-Canada Artificial Intelligence and Data Innovation Consortium, our team includes community leaders, local chiefs of funds, policymakers, and the collaboration among ACADIC multidisciplinary and multi-stakeholder team of scientists, mathematicians, public health experts, and community leaders has been helpful in securing locally relevant data. In our consortium, the community leaders articulate the problem. So we don't go to them and say, we know the problem. No, in their communities. And then us, the modelers, we inform the collection of the data for the problem. And the community leaders the whole community is involved at every step of the process. The models that we develop are tailor-built to solve the problems affecting the community. And this has been one of the keys to our success in informing COVID-19 policies in Africa. In Africa, there's stigmas attached to being infected with SARS-CoV-2. And moreover, self-medication and the use of complementary medicine are common among Africans for social, economic, and psychological reasons. Government in these countries are generally faced with a number of challenges, including limited resources and poor infrastructures and patient health literacy. So for COVID-19, this is fueled by the rapid spread of rumors in favor of these modalities on social media. Hence, irrespective of how those of us academic and public authorities are with the communities, there is bound to be so much underreported data in most communities. Thus, to have a clear picture of the nature of an epidemic, the true case count, the basic reproduction number, relative effectiveness of severe infectious, mild infectious, and asymptomatic. After securing relevant data, academic modelers design artificial intelligence-based algorithm to estimate the underreported data.
Dr. Kong 早前与其他学者举办了网上座谈会，讨论人工智能如何在消除不平等问题上扮演重要角色。他们还发表并刊登了一系列研究报告。
Our work has been covered by all main TV, radio, and newspapers in this country and other international media hundreds of times. We have organized several conferences and workshops in Africa and here in Canada. Now, with the capacity to generate true case count, we next design different indices for each local community using true case count and other locally relevant information. Using this data, we trained an AI algorithm to come up with a 5-level alert system by splitting the jump from full lockdown back to business as usual into 5 levels. In order to quantify the effort of the alert system, a stringency index was carefully created for each alert level, and the calculation of this stringency index takes into account the status of various indicators that represent a number of non-pharmaceutical interventions. We did use AI and big data techniques to identify hotspots in Africa. The importance of hotspots, also known as spatial clusters in infectious disease epidemiology, cannot be overemphasized. Identifying local hotspots for an epidemic help to inform resource allocation and programmatic goals. So over the past decade, there have been increasing interest in spatial clusters for infectious diseases, and this includes calls to target spatial clusters in outbreak. For example, recommendations to focus on hotspots has been part of strategic plans for Ebola, malaria, COVID-19, and other emerging pandemic threats. So in the ongoing COVID-19, academics visualize hotspots in each local community across Africa, and this has been very helpful to policymakers in different levels and the population. We have been able to leverage AI and big data techniques to optimize clinical public health and vaccination rollout strategies. Once vaccine became available in Africa, the academic leveraged artificial intelligence and big data techniques to develop strategic, highly targeted, and staged delivery plans of vaccine to prioritize vulnerable, at-risk population and hotspot areas that we already identified. Deploying and administering effective and safe vaccine against a novel disease to large populations at a fast pace is a non-trivial task. Due to the logistical challenges that exist in Africa, an assessment of different vaccination scenarios and rollout strategies that take into account national and local realities is of paramount importance for public health policy and decision-making in order to maximize and track stage progress towards the achievement of herd immunity. Our rollout strategy has been adopted by governments in the 9 African countries that we're working in. We were able to provide near-term forecast, now called nowcasting of labor market flow in Africa. Labor market flow, you could think of unemployment. So the unemployment rate is an important economic indicator that is input into decision-making by policymakers. In Africa, they are usually released infrequently with substantial delay. The speed of economic decline during the onset of COVID-19 made policymakers confused as to what to do to get timely information about the labor market. And to this end, ACADIC, or the Africa-Canada Artificial Intelligence and Data Innovation Consortium, immediately employ artificial intelligence to provide a framework that can be used to provide more timely information about the unemployment rate in countries across Africa. In the upcoming year, there will also be an uncertainty about the timing and the extent of any improvement in labor market outcomes that will also highlight the value of the framework that we have come up with.
这些社群可能是比较容易受感染的群体，除了因为工作而暴露在病毒当中，居住环境通常很拥挤，并由于经济困难，只能依赖公共交通的工具上下班以及外出。同时，由于缺乏获取最新卫生资讯的途径和设备，以致出现比病毒流传得更快的资讯流行病。
We have been assisting stakeholders to address dis and misinformation about COVID-19 prevention, treatment, and vaccines. Since the outbreak of COVID-19, rumors about COVID-19 have been doing rounds on social media in Africa. These include things like this or that traditional medicine can cure COVID-19 or prevent one from having one. Afofo, which is a locally made alcohol with a non-alcoholic content, can prevent you from having COVID. This or that pastor can cure COVID-19. SARS-CoV-2 does not affect Africans. Chloroquine cures COVID-19. Spraying alcohol and chlorine all over your body will prevent you from having COVID. SARS-CoV-2 cannot survive in Africa's warm climate. Steaming your face with an inhaled neem tree, which is a common tree in Africa, leaves prevent you from having COVID-19. Vitamin C tablets prevent COVID-19. Having had malaria makes one immune to COVID-19. Pepper soup, which is a locally made soup in Cameroon, with lime or lemon flushes out the virus. Drinking black tea first thing in the morning prevents you from having COVID-19. To support local stakeholders in addressing all these infodemic, ACADIC employ artificial intelligence and big data to identify hotspots. In addition, ACADIC helps support communication strategies with local stakeholders that address the root causes of these infodemics.
Dr. Kang 指出，疫情下有一些国家因为反应迟缓，很多社群与个人都因为性别、肤色、地理位置、阶级、本土性、族裔等因素，已经受到更明显的不公平对待和打击。在获取公共卫生资讯、病毒检测、经济援助及医疗服务等分配，因而受到歧视或忽视。未来再爆发新的疫情或公共健康危机时，如何做到公平、公正，都是各国政府制定应对策略必须考虑的事项。以上就是本期内容，各位观众如果想重温的话呢，可以登入城市电视网站，点击节目重温当中家国纵横的链接就可以了。我是康凯，下期节目再会。